subject here. We're getting a ton of questions about school and summer camp, and I do want to address those. So, can you guys see my new crystal ball?
It's
Alison,
pretty.
yeah, thank you. Alison, I know your crystal ball has been hard at work on forecasting what's going to happen in the fall. So why don't you talk to us a little bit about school?
Sure.
And in particular, I want to know your general thoughts about school and about how we can think about these issues of harm reduction in kids in school.
Yeah. So this is obviously a topic on like literally everyone's mind. And it's true whether you're a parent or a staff member or teacher at a preschool versus all the way up to higher ed. But maybe let's focus on sort of K-12 right now. A lot of states, Pennsylvania included, are starting to issue some guidance to states, to school districts within the state. Pennsylvania, for example, has published basically a set of requirements for a health and safety plan that every school district, every public school district is required to file, and private and parochial schools are strongly encouraged to file and get approved by whatever their governing body is. And it covers everything from ventilation and bathroom cleaning to, how do we organize classrooms? How do we get desks apart from each other? How do we think about grouping kids? And I will say, at least for the schools that I've spoken to, it's pretty overwhelming. And I think one of the overwhelming things is they don't necessarily know where to start and where to prioritize. So for example, of all the things that the state of Pennsylvania is asking schools to consider in their plans, I think there were 81 considerations in this template plan. Which ones are most important and which ones are going to make the biggest difference? And we don't have strong evidence yet on that. So I think most of the guidance that sort of epidemiologists and public health folks are talking about now is sort of applying other lessons from infectious disease to the school setting. And then the other big piece of this that I want to mention is there's, of course, huge variation in the resources that schools and school districts have to implement this stuff. So if I just think about here in Philadelphia and our school district, a lot of our buildings are very old. They were built in the 1920s and 1930s. They haven't been sort of renovated continuously, and the HVAC systems are old. And when we think about like the ideal ventilation we'd have, where I think you want to turn over the outside air and the inside air like 4 times an hour, those HVAC systems aren't up to that. And then when you hear like, well, just keep the kids outdoors all day, that's challenging too with big urban schools. So
in winter.
In winter, yes.
And Amanda and I live in
Hawaii. Winter starts early in Wisconsin.
It starts in September.
Exactly. Yeah. So it's a great plan for the first 2 weeks of September. And I think the other big question mark for schools is, are we going to have a big second wave of cases in like October, November? I mean, the modeling would certainly suggest that's very, very likely. If nothing else, flu season will start. And how do we set up a plan so that if some trigger is triggered or some benchmark is triggered, everybody goes home again? So how do we plan now for kind of nimble flexing in and out of school? And I think that just like triples, quadruples, exponentiates the complexity of planning. I think there's a lot of pressure to get kids back to school. And then the tension is with a lot of other people worrying about teachers, about vulnerable people in kids' households, and to what extent is being back at school going to be another engine for transmission in the fall. So that was a lot of concerns. That was not a lot of answers or crystal ball stuff, but that's what's on people's mind. The schools I'm talking to, all that stuff is what's on their mind.
What strikes me is just how much this has revealed about the extent to which our schools are under-resourced and how much we rely on them to provide social services in addition to educating our kids. It's really a striking example of how much challenge the schools face under regular circumstances, and now being tasked with this huge additional planning process is really hard.
Yeah, I think we're starting to see this week some evidence, some early, rapid evidence from the education field about how much kids have missed, like how much learning gap have we produced just this spring with going to learn from home, and the kids most at risk for increased gaps if the fall is also not in person.
Yeah. Any additional thoughts on returning to school from Jen or Amanda?
I think many of those same issues exist at the university level. And like Alison said, I'm involved in some of those committees, and the nimbleness, being able to have a systematic way to identify that we're reaching a tipping point where the opportunity cost of being in person is going to, be too high, and being able to scale back, pull back, and come up, revert back to distance learning or online classes. Some of the other strategies that I've seen thrown around there are either starting a semester early or ending it at Thanksgiving. So especially at the university setting, that could be a solution to avoid people traveling home for Thanksgiving and then traveling back to campus during what will likely be, if we get that far, both flu and COVID circulating. And so I think there's a lot of adaptive solutions that are on the table right now in trying to hedge what's going to be the most reasonable approach. That, we can't eliminate all risk, but if we want to go back to in-person instruction, what are the best bang for your buck strategies, and then that, how can we be flexible? And so that, that was one other thing that I've seen thrown around. And then this idea of cohorting, which maybe Jen wants to talk about, right? This idea that, and Alison, you've also, talked about this, this idea that a major strategy could be to have consistent groups of kids, either whether that's in a K-12 situation or a university situation. I liken that to sort of advanced learning communities at the university level sort of already do this. You really have intense living situation and learning situation with a set group of people. And, that makes tracking cases more easy. It makes, it eliminates some of that cross-pollination where we would have increased spread. So I don't know, maybe Jen, do you want to talk a little bit about that?
Yeah, I'll jump in on that, because exactly the paper that Alison was referencing used social network analysis to kind of, it's very similar to the idea of the bubbles, but kind of applying it to the school setting. But the basic idea is this small world effect, that the sort of 7 degrees from Kevin Bacon thing, that we're all actually really connected with just a few steps from all the people we know. And this is, really true at universities and schools. But you can kind of show that just repeating interactions more with the same people, so the bubble, or kind of cohorting groups of students who have more of their student classes and living arrangements together, it really does reduce these connections, the time it takes to kind of, for all these social networks to reach each other. And, really, it can reduce the spread of the infection a lot, or at least, slow it down, which in the context of COVID is still really important. So, no, I think the cohorting idea is really great if we can get people into kind of smaller groups. Even in the K through 12, I was sort of, thinking how this might work of sort of in high school. It's, it might be harder, but if you can sort of have that flexibility that Alison mentioned with, A and B groups that maybe do a little bit of on and off of in-person or, remote learning. I think these might be strategies that we, yes, need to plan ahead and think about kind of before the crisis point hits. So I really like Amanda's idea that we should have some decision rules ahead of time, instead of, once a case or a few cases crop up, everybody panics and shuts down the schools again. I think it's really important that we plan ahead of time sort of what those important decision points are, what sort of these hybrid intermediate steps might be of pulsing on and off home instruction. But I think what we've really shown, and what we're learning about the super spreading events, is that some of these just smaller, interventions that we're talking about can have a big effect on suppressing the transmission. So, we shouldn't underestimate what these small measures could do across, entire communities.
And I think one other public health topic that I'm not sure Dear Pandemic has addressed yet is the idea of surveillance. And how do we monitor for an outbreak cropping up, especially if we have this 2-week lag before we see it in, population level positive cases. I know here at UW-Madison, there's some talk about how do we do surveillance. And in public health, that word surveillance means we are doing some kind of structured program to monitor for disease, right? So it could look like random sample testing, or in some places they're actually testing the public sewage system to see what the viral load is locally as a method of surveillance.
Right?
What's that?
Schools could use that as part of the science
Chemistry
curriculum.
class.
Yeah, sure. Virology might become a really popular subject going forward here. Yeah, so I think the other thing I want to emphasize about looking ahead to fall is that my crystal ball has not been working very well.
Hit the 8 ball.
September is super far away in pandemic time. So it is impossible to model what is going to be happening pandemic wise in September. And so I think this point of having flexibility and contingency planning is really all we can do at this point. If you want to know what to do in September, it has to be like an if then kind of a plan, because there's just no way to predict what's really going to be happening by then.
And it'll be different state to state and
yeah,
even county.
Absolutely. Yeah, because of that that heterogeneity that we talked about before. So
maybe we can have some new treatments or good news on the.
Yeah, exactly. And also the disease itself and our response to it in a treatment setting is evolving. So lots of things could happen by September. I mean, when I think back 3 months ago, in fact, I think this might be the 3-month anniversary of Dear Pandemic. Now that I think about it, everything was different, right? So 3 months is a long time.
It seems like 3 years.
It seems like 3 years. It really does.